In this video, I am going to talk about kinetics of elimination of a drug. Before we dig deeper into the kinetics of elimination, it is important to have some previous knowledge about the clearance of a drug, the elimination half-life, how is half-life related to the steady-state plasma concentration of the drug and its implications in clinical practice. So let's start off with the definition of clearance. So what is clearance of a drug? Clearance of a drug can be defined as the volume of plasma from which the drug is completely removed in unit time. Clearance can be calculated using the formula clearance is equal to rate of elimination by concentration of the drug. Next, what is half-life of the drug? Half-life of a drug can be defined as the time taken for the plasma concentration of the drug to fall by 50% of its earlier value. So in 1 t-half, 50% of the drug is eliminated. In 2 t-half, there is further reduction by 50%, so 75% of the drug is eliminated. In 3 t-halves, 87.5% of the drug is eliminated, and in 4 t-halves, 93.75% of the drug is eliminated from the body. So for complete elimination of drugs from the body, 4 to 5 t-halves are required. How is half-life related to the steady-state plasma concentration of the drug? When a constant dose of a drug is administered at regular intervals, a steady-state concentration is achieved after 4 to 5 half-lives. Up to 5th half-life, the plasma concentration keeps on increasing, but thereafter it reaches a steady state level, that is a plateau level, where the rate of drug entry is equal to rate of drug elimination. So this is a state at which there is no further accumulation of the drug with repeated administration. So how is this information relevant in clinical practice? As we have seen, at the steady state level, the drug input is equal to drug output. That is, the rate of drug absorption is equal to rate of drug elimination. If there is an impairment in the elimination system, which is the kidney, the primary excretory organ, the liver, which is the main site of drug metabolism, and other sites being GI tract, lungs, plasma. So any impairment in the elimination system alters the steady state concentration and predisposes to toxicity to a drug which is tolerable to a normal healthy individual. Secondly, as we have seen, 4 to 5 t-halves are required for the drug to attain a steady state plasma concentration of the drug. So this implies that if the dosing regimen is changed, another 4 to 5 t-halves would be required to attain a new steady state concentration of the drug. So the previous steady state concentration changes to a new steady state and the time taken would be 4 to 5 half-lives. So this principle should be kept in mind when the physician makes changes in the dosing regimens, and this is particularly important for drugs with a narrow therapeutic range when relatively small changes in the dose will produce a disproportionately large changes in the drug concentration. So now that we have an understanding of clearance and half-life, we now shift our attention to the different types of kinetics, the first order and zero order kinetics, the difference between the two kinetics and the clinical relevance. So what is first order kinetics? In first order kinetics, a constant proportion, example, a percentage or a fraction of drug that is eliminated per unit time. If the initial plasma concentration of the drug is 256 in 0 hour, in 2 hours, there is 50% reduction in plasma concentration, which is 128. In next 2 hours, there is further reduction in 50%, which is 64. In next 2 hours, it is 32, and there is a decline in plasma concentration in a similar fashion till the concentration becomes 0 in 16 hours. So it is observed that a constant proportion of the drug, that is 50% of the drug, is eliminated in unit time, that is every 2 hours. Secondly, first order kinetics is a concentration dependent process, which means that higher the concentration, faster is the clearance. So as the plasma concentration increases, the clearance also increases. This is because all the enzymes and clearance mechanisms are working well below the maximum capacity, and the rate of drug elimination is directly proportional to the drug concentration. If we look at the calculations of first order kinetics, we have learned that the formula of clearance is rate of elimination by plasma concentration. So in first order kinetics, the rate of elimination is directly proportional to the plasma concentration and the clearance is constant. So the rate of elimination increases, the plasma concentration also increases, and clearance is the constant value. And since clearance is a constant value, T half is also constant. So let's move on to zero order kinetics. In zero order kinetics, a constant amount of drug is eliminated per unit time. For example, if the initial plasma concentration of the drug is 80 in 0 hour, there is a reduction by 10 molecules to a concentration of 70 in 2 hours. In next 2 hours, there is further reduction by 10 molecules and the concentration is 60. In next 2 hours, there is reduction by same 10 molecules, that is, the concentration becomes 50. So in a similar fashion, there is a decline in plasma concentration and each time 10 molecules are reduced every 2 hours. So that at 16 hours, almost all the drug is eliminated from the body. Therefore, unlike first order kinetics where a constant proportion, that is a fraction of the drug is eliminated in unit time, in zero order kinetics a constant amount of drug is eliminated in unit time. This is because the elimination systems and the enzymes are saturated and a constant amount is eliminated even if the plasma concentration rises. So regardless of the plasma concentration of the drug, the elimination rate remains constant. Next, zero order kinetics undergoes constant elimination regardless of the plasma concentration. So if the elimination rate remains constant and the plasma concentration rises, there is accumulation of the drug and the drug persists in the body for a longer time, taking more time for the elimination of the drug from the body. So zero order kinetics is time dependent, unlike first order kinetics which is concentration dependent. That is, the rate of elimination increases as the plasma concentration increases. Coming to the calculations of zero order kinetics. Clearance is given by the formula rate of elimination divided by the plasma concentration of the drug. So in zero order kinetics, the rate of elimination is constant. So since the rate of elimination is constant, clearance is inversely proportional to the plasma concentration of the drug. That is, if the plasma concentration increases, clearance decreases. So there is accumulation of the drug persists in the body for a longer time, the T half of the drug increases. So zero order kinetics is time dependent. So how is the understanding of kinetics of elimination useful in a clinical setting? Determination and understanding of how a particular substance is eliminated are important when assessing a patient who has ingested a toxic substance. That is, this information is useful in assessing toxicity. With regard to toxicology, if the ingested substance is unknown to the patient and the practitioner, routine blood plasma testing of the substance and analysis of the decline in concentration will aid in the identification of the ingested substance. So this will indicate the substance and its properties. For example, if a substance follows a zero order kinetics, the amount eliminated will depend on time and not the amount ingested. In contrast to first order kinetics in which the amount eliminated will depend on the maximum blood plasma concentration and not the time. As we have learnt earlier that zero order kinetics is time dependent, that is, more time is taken to remove or eliminate the substance from the body compared to first order kinetics which is concentration dependent, where the rate of elimination is directly proportional to the concentration of the drug. Now, once the substance and its properties are understood, proper treatment can be given to a patient who has ingested the toxic substance. For example, in case of methanol ingestion, urgent treatment is necessary because methanol follows zero-order kinetic elimination, which is time dependent and not dependent upon the amount ingested. So in case of methanol poisoning, the clearance decreases, the T-half increases, and therefore urgent treatment is necessary in this case. A clinician can understand that the actual danger lies in the time from ingestion and not the total amount, because the T-half is long and clearance is decreased and the drug persists in the body for a long time. Now let's understand what is non-linear elimination kinetics. Non-linear elimination kinetics is the term which describes drug clearance by Michaelis-Menten processes, where a drug at low concentration is cleared by first order kinetics, but at high concentration the kinetics changes from first order to zero order kinetics. For example, drugs such as phenytoin ethanol shows non-linear elimination kinetics, where the kinetics rapidly changes from first order to zero order kinetics. So Michaelis-Menten model describes the relationship between the concentration of the drug and the rate of enzyme mediated reaction. So at low concentration, the more substrate you give, faster is the reaction. But at high concentration, the rate of reaction remains the same because all the enzyme molecules are busy, that is, the system is saturated. So there is no further increase in the rate of reaction. This brings us to the end of the topic. These are my references. Thanks for watching. Please like, subscribe and share.